Hello, everyone. My name is Dr. Babajide Ogunseinde. I am an orthopedic spine surgeon still in clinical practice. I am finishing my MBA in October of 26, 2 months from now. And I've been very excited participating in the Stanford University Healthcare Leadership Certificate Program. I would like to share a patient story that changed how I think about healthcare leadership and the importance of listening. So, several years ago, I met a woman in her 50s who had been living with severe low back pain and pelvic pain for years. She had seen multiple providers, completed physical therapy, taken pain medication, and undergone several injections. Every treatment helped her for a short time, but the pain always returned. So when I first met her, she wasn't just frustrated, she had lost hope. She told me, "Doctor, I don't want another temporary fix. I want my life back." At that moment, I realized my job was not simply to treat pain. My responsibility was to identify the true source of her pain. Research shows that the sacroiliac joint is responsible for approximately 15 to 30% of chronic low back pain, yet it's frequently overlooked. That statistic reminded me that even common conditions can be missed if we stop asking questions too soon. So, after reviewing her history, imaging studies, physical examination, we decided and determined that her sacroiliac joint was the primary pain generator. So together we discussed every treatment options, including risks, benefits, expected outcomes. She chose to proceed with a minimally invasive sacroiliac joint stabilization. So we planned for the surgery. The surgery itself was the one chapter of the story. Several weeks later, she returned for follow-up. She walked into the clinic with a smile instead of grimace that she normally had. She told me she had gone to the grocery store shopping without needing to stop because of the pain. She was sleeping through the night again. Most importantly, she said she could once again play with her grandchildren. Those moments reminded me that success in healthcare is not measured only by imaging studies or surgical techniques. It is measured by restored independence, renewed confidence, and improved quality of life. So that experience also changed me as a physician. I learned that leadership in healthcare begins with listening before speaking, understanding before treating, and partnering with patients instead of simply directing them. Data and statistics are essential because they guide evidence-based decisions. But numbers alone never tell the entire story. Every statistic represents a person, a family, and a life waiting to be restored. So today, whenever I face a difficult clinical decision, I remember that patient. She reminds me that meaningful change happens when compassion and evidence work together. So, the greatest lesson I learned is this: healthcare is not about fixing diseases, it is about helping people reclaim their lives, one patient, one conversation, and one thoughtful decision at a time. So I want to thank you for giving me this opportunity. And I would like to say that the Stanford University Healthcare Leadership Certificate has been very helpful and has made a change in my life. Thank you.